American men are, wow, sicker and die earlier than men living in other developed nations.
That's surprising to hear, and that's according to a new report from the Commonwealth Fund, which is a nonprofit organization focusing on public health issues.
Now, the study looked at men from 11 developed countries, including the U.S., the U.K., Switzerland, and Norway even, and found that rates of avoidable deaths, chronic conditions, and mental health needs are the highest with American men. And we want to bring in Dr. Nelson Bennett, a urologist at Northwestern Medicine. Dr. Bennett, thank you for being here with us. Let's take a look at some of these stats, and if you can, just talk about the issues here.
Yeah, this Commonwealth Fund study was done in 2020, and it was a survey study. They asked a bunch of men, 18 plus around the world, about their healthcare systems and how they felt about it. Turns out that here in the United States, we have the highest risk of avoidable death. For some reason, we as men, we don't like to go to the doctor for preventative care. And in this particular study, cost was cited as the major reason why. We know that 16 million men here in the United States are without health insurance. And of course, there are multiple reasons for that. Additionally, this study outlined that American men do not think very highly of our healthcare system, for whatever reason that is. And then on the good side, on the positive side, we have decreased prostate cancer deaths as compared to other industrialized countries. So that's a new finding for this study.
If you can, elaborate a little bit more on the fact that us fellas do not like going to the doctor and the kind of impact that can have on our health versus the health of women.
Absolutely. So just to recap, men do not like to go to the doctor, and whether it's because we're stubborn or whether it's because we don't want to appear weak or vulnerable, or we just don't want to take time away from our daily schedule, we don't want to go to the doctor. I think part of it is we don't want to figure out that something is wrong with us and then have to take care of it.
Right.
Women tend to go to the doctor much more readily and also do their primary care visits more readily than men do.
Yeah, seems like we're always the ones doing the pushing there. Okay, this is interesting too. Let's talk about disparities here. So men in the U.S. also die from avoidable deaths, which are classified as deaths before 75 years of age, at a higher rate than men from the 10 other countries in this report. The study is pointing to income disparity as a factor. How would you say that impacts American men as well?
That impacts American men at a great rate. Men with lower income tend to have more unhealthy habits. At least that's what this study elucidated a little bit. So that may be one of the reasons why men die at a higher rate than women in this industrialized country versus others.
And you talked about the difference it's made in cancer-related deaths. I remember when my father was diagnosed with prostate cancer and people were like, oh, he'll be fine. And I'm like, it's still cancer.
Right.
But there have been a lot of advancements there.
There have. One of the biggest things that we did here in the United States in the past 10 years is we repopularized prostate cancer screening. So that's a PSA, a blood test once a year, plus an examination. And that finds prostate cancer at a much, much higher rate than just waiting for it to get bad and then trying to treat it.
Yeah, guys out there, we cannot stress this enough.
Yes.
Take your butt to the doctor, and not just when something's wrong. Go get a checkup, okay?
Yeah.
Dr. Bennett, appreciate your time this morning.
You're welcome.
You're
Thank
not
you.
one of those, are you?
Oh,
You
no,
go?
I go regularly.
Yeah.
It's good.
Yeah.
It's good.